Hello again. So now I'm going to discuss my second article that I found for our nursing project. Hopefully you've seen the first video because the second article does relate to the first video on retention of nurses. So the title of this is Outcomes Better in Magnet Than Non-Magnet Hospitals? Not So Fast. This is by Carol Potera. It is found in the American Journal of Nursing in February 2012. So this article does explain a little bit more research than the first one. It does have more evidence collected and data collected than the first article. The differences in staff this article focuses on staff differences and how non-magnet hospitals are actually better staffed than magnet hospitals. Mostly because magnet facilities want you to have a bachelor's degree or at least working on a bachelor's degree. And non-magnet hospitals don't particularly care for that, even though we all know the standard of nursing is going to bachelor's. But magnet hospitals pride themselves. They have to have a certain amount of bachelor certified nurses, and they have to have all these kind of competencies in order to reach magnet status. So the second article says that sometimes the hard work has to be done by staff at magnet hospitals, as far as making sure all competencies are completed and all kind of stuff like that. And it is a process, and it is hard work for everyone who is working at the hospital in order to do this. And so it sometimes can be frustrating, and that makes people want to leave the hospital. Non-magnet hospitals can be good in retaining nurses because they focus more on staff instead of the core competencies. Not saying that they don't focus on the standard practice, because they do. It's just they aren't so focused on we've got to do this, we've got to do this, we got to do this, that it drives the staff out of the environment. So the article does suggest that it's important that you focus on how your hospital is run. Magnet status is important, and it's nice to obtain because it shows the community that you work hard for that status, and all the and that your standard of practice is what is being used at the hospital. So that does make patients want to come to hospitals, but as far as having nurses want to stay and work at that hospital, sometimes it can be more stressful, and I have been in part of that situation, as I mentioned in the last video, where being at a magnet hospital was almost more stressful than, just working at a non-magnet hospital like I do now. So there's definitely pros and cons. I chose this article because it does relate to our PICO question on, good environments and retention of nurses, and if magnet status does actually improve. Majority of our information does support that magnet status does improve the work environment and people want to be a part of it versus non-magnet hospitals. However, I just wanted to throw in and play devil's advocate on a con to being a magnet status, and that is, sometimes the stress and the workload is increased and the demand is also increased, but the staff and the supply of hospitals to actually meet those needs are lacking, and therefore it can be, not beneficial if you have not enough staff, but you have all these tasks, and then that decreases your workload, your compliance, and, your overall your patient care, because you don't spend time, sitting with the patient, talking with the patient, and really getting to know information and being with them, which can improve a stay in the hospital. Instead, you're focusing on charting and meeting the core competencies and this and this and this and this and this and other steps that you do have to make in order to reach that magnet status. So just wanted to play devil's advocate, and that is basically my second article. Thanks!